Good day everyone, welcome to our vlog. So I am your host or your instructor, Respiratory Jaynaicel, together with our expert for today, which is Doc or Miss Desoyo, Vanessa, to guide us, my dear learners or audience, the importance, the function, disease, and more necessary of the topic details. So, what is respiratory system?
As you've mentioned earlier, your question is about the respiratory system. When we say respiratory system, it is a network of organs and tissues that help you breathe. So it includes your airways, your lungs, and your blood vessels. So the muscles that power your lungs is also part of the respiratory system. So these parts work together to move oxygen throughout the body and clean out waste gases like carbon dioxide.
Go on. So as specialists, can you highlight or elaborate the functions and the usage of our certain topic?
So the respiratory system has many functions. Besides helping you to breathe in and breathe out, it also allows you to talk and smell. Yes, of course. It also warms air to match your body temperature and moisturize it to the humidity level your body needs. Also, it delivers oxygen to the cell in your body. Also, the functions of our respiratory system is to remove waste gases, including carbon dioxide, from the body when you exhale. And also, it protects your airways from harmful substances and irritants. Now, let's move on to the usage of our respiratory system. So, the respiratory system has many different parts that work together to help you breathe. So, each group of parts may have many separate components or organs. So your airways deliver air to your lungs. So from the lungs, your bloodstream delivers oxygen to all your organs and other tissues, such as muscles and bones, that help move the air when you inhale into and out of your lungs. So generally, respiratory system is responsible for breathing, gas exchange, internally and externally, speech and phonation, and also the olfaction. Okay, so Miss Jaynaicel, apart from what I said, I bet you've had learnings. So may I test the parts or the organs of the respiratory system and its function as you insist in this vlog about?
So basically, many of us only knew when we talk about respiratory system, the nose, the mouth, and our lungs. So let me widen your all idea or knowledge as the parts and the functions of system tracing. Indeed, breathing happens automatically. So do you all know that every day, our body breathes about 20 times until we reach the age of 70 years old, up about 600 million breaths we take. A system that brings air into our body or lungs is divided among such. First, the upper respiratory tract. The first airway organ or parts is our mouth and our nose. So, at the top of respiratory system, the nostrils bring air into our nose. Remember, not just the nose serve as opening that pull air from outside into our body system, also our mouth. So, the nose where it filter, warm and moist. Pharynx back the two airway of our nose and mouth to meet up. The pharynx which located at the back of our throat. Well, the next one is bronchial tubes. It is a tube at the bottom of our pharynx that connect into each lung. Main components organ of our respiratory system is our lungs. So the lungs is a two organ that remove oxygen from the air and pass it into your blood. So some of the bone and the muscle in the respiratory system include our diaphragm. The diaphragm, it is a muscle that helps your lung pull in air and push it out. The next to the diaphragm is our ribs. The ribs, it is a bone that surround and protect your lungs and our heart. Let's tackle about the lower respiratory system part or organ. First, alveolar function that looks like a grapes enable fresh air to get to our air sacs. So in the lungs, where the exchange of oxygen and carbon dioxide take place, is the bronchioles. It is a small branches of the bronchial tube that lead to the alveoli. The next one is the capillaries and its function. The capillaries, it is a blood vessel in the alveoli walls that move oxygen and carbon dioxide.
Okay, so when we say asthma, symptoms vary from person to person. So you may have infrequent asthma attacks, have symptoms only at certain times, such as when exercising, or have symptoms all the time. So the treatment for asthma are the following. So record how well your lungs are working. If your lungs aren't working as well as they should be, your asthma may not be under control. Okay, so the next common illness is the pneumonia. Yes, it is very known to us. So when we say pneumonia, it is an infection in one or both lungs caused by bacteria, viruses, or fungi. So the infection leads to inflammation in the air sacs of the lungs, which are called the alveoli. So the alveoli fill with fluids or pus, which making it difficult to. So the prevention for pneumonia is to get a vaccine. So vaccination, the first line of defense against pneumonia is to get vaccinated. So there are several vaccines that can help prevent pneumonia. So the treatment for pneumonia is the OTC medications. So your doctor may also recommend over-the-counter or the OTC medications to relieve your pain and fever as needed. So this may include aspirin, ibuprofen, Advil or Motrin, or any antibiotic prescribed. So the next common illness in the respiratory system is the bronchitis. So bronchitis occurs when the bronchioles or the air carrying tubes in the lungs are inflamed and make too much mucus. So chronic bronchitis is usually, but not always, take note, but not always, caused by smoking tobacco. So it can also be caused by exposure to secondhand cigarette smoke, air pollution, dust, or toxic gases. So your risk can be increased by family history of bronchitis, having asthma and allergies, and having gastroesophageal reflux disease or the GERD. So what is the symptoms of the bronchitis? So a cough that is frequent and produces mucus. Next, a lack of energy and a wheezing sound when breathing. So it also shortness of breath. So the treatment for the bronchitis, so you may not need any treatment, or you might use over-the-counter drugs that break up mucus or that treat fever or pain. If you have a bacterial infection, your doctor might prescribe medicines like chronic bronchitis, considered to be chronic obstructive pulmonary disease or the COPD, is not curable yet. Symptoms can be treated using a variety of methods, including drugs, oxygen therapy, pulmonary rehabilitation, and surgery. The next common disease is the influenza. So when we say influenza, it is a viral infection that attacks your respiratory system, your nose, throat, and lungs. So influenza is commonly called the flu, but it's not the same as stomach flu viruses that cause diarrhea and vomiting. So the treatment for influenza, usually you'll need nothing but more than rest and plenty of fluids to treat the flu. But if you have a severe infection or area at higher risk of complications, your doctor may prescribe an antiviral drug to treat the flu. So the next common illness is the pulmonary fibrosis. So when we say pulmonary fibrosis, it is a lung disease that occurs when the lung tissues become damaged and scarred. So this thickened, stiff tissues makes it more difficult for your lungs to work properly. So as pulmonary fibrosis worsens, you become progressively more short of breath. So the treatment for pulmonary fibrosis is medication. So a doctor may recommend newer medications to treat your pulmonary fibrosis. So the next common illness is the tuberculosis or the what we call TB. So it is caused by a type of bacterium called Mycobacterium tuberculosis. So it spread when a person with active TB disease in their lungs cough or sneezes and someone else inhales with expelled droplets which contain the TB bacteria. So the treatment for tuberculosis or what we call TB, if you have latent TB, your doctor might recommend treatment with medication if you are at high risk of developing TB. The exact drugs and length of treatment depend on your age, overall health, possible drug resistance, and where the infection is in your body, same with other diseases. So next, the common illness is the lung cancer. So lung cancer occurs when cells in the lungs divide uncontrollably, causing tumors to grow, forms in tissues of the lung, usually in the cells that line the air passages. So the majority of lung cancer cases can be traced by cigarette smoking. Specifically, the DNA changes that lead to the development of lung cancer occur after harmful chemicals, such as those contained in tobacco smoke, are breathed in. Yet, some develop in not active in that activity. So the treatment for lung cancer is surgery. So during surgery, your surgeon works to remove the lung cancer and a margin of healthy tissues. So radiation therapy uses high-powered energy beams from sources such as X-rays and protons to kill cancer cells. So chemotherapy uses drugs to kill cancer cells. One or more chemotherapy drugs may be given through a vein in your arm or taken orally.